This is gonna sound like crazy talk for a second, but by texting and looking down at your phone all the time, you are affecting your fat loss. Okay, I know it sounds crazy, but hear me out on this entire thing. I'm talking today about text neck. Something that is really becoming a big issue right now, and it all has to do with the fact that we're looking at our phones all the time. We're not going to change people looking at their phones. It's just part of society today, so I figured, why don't I break down what exactly is happening when it comes down to text neck, and what's happening to your vertebrae, what's happening to your spine, but also what is happening to your lungs, because it's pretty alarming. So first off, let's take a look at the human head. Let's take a look at what happens when the head is tilted. First thing we have to take a look at, the human head on average weighs about 12 pounds. It's no little dainty thing. It's pretty darn heavy to begin with. But the second that it starts being tilted to a specific degree is when we start having some issues. When we have a 15-degree tilt of the human head, it goes from 12 pounds to 27 pounds. Okay? Then when we have a 30% or a 30-degree tilt, we end up having a 40-pound head. But when we have a 60-degree tilt, which is roughly what it is when you're looking down at your phone, that 12-pound head of ours ends up weighing 60 pounds. So that's like carrying a 60-pound dumbbell or a giant bag of rice just on your head all the time. We don't realize it because we're constantly doing it, but that's putting a lot of stress on the body. Now, even the National Library of Medicine found that on average, most people today under 30 are spending 1,400 hours per year looking down at their phones with that 60% tilt. So we're talking 60 pounds for 1,400 hours a year. Now, that's definitely going to cause a problem. Let's talk about these different problems though. First off, obviously, you're going to have stress on the C-spine. You're putting all kinds of stress on the ligaments. You're putting all kinds of stress on that portion of your spine. That's a no-brainer. So everything in your neck and slightly into your upper back, you're going to have those issues. You probably are starting to feel them already. But the big issue starts coming into the ligaments. People don't typically think about what's happening with the ligaments. They're focused on the spine. They only think they're discs and they're vertebrae. But the thing is a lot of the problem ends up coming down to the ligaments. If you were to take your finger and you were to bend it back and hold it like that for a minute, you'd start to feel some pain in your ligaments right around here. Well, imagine what's happening on your neck. See, we're in a position where we're not always thinking about it simply because we're preoccupied and we're looking at our phones. So we don't feel that stretch in our ligaments, but that's the big thing. Okay, then we have to look at what's happening with the intervertebral disc. That's going to be the issue where the disc is actually bulging out, where we're having an issue with the disc itself. But the other thing we have to look at is the weakening of the shoulder blades. You see, what happens with your scapula when you're constantly looking down is it's taking the tension off of the shoulder blades. So therefore, your scapula and the muscles that retract the scapula are getting really weak. So you didn't realize that by looking down at your phone, you're putting all this pressure on your neck and you're strengthening your neck muscles because they have no choice, but you're allowing the shoulder blades to become weak. This is going to contribute to more of that anterior tilt that we don't want in the first place. But also it's going to literally weaken your back exercises. It's going to make it so you're not able to get as much effectiveness. And remember, the back is a big muscle. So if we get good back workouts in and we can really train our back, we can get a lot of metabolism boosts. So no sense in weakening that. That's one thing that I noticed. I noticed that I was starting to feel weaker in my shoulder blades. I was starting to get more pain simply because my shoulders were rolling forward and those muscles weren't having to do the job of retracting anymore. Okay, but then we go back to the ligaments again. So those stretched ligaments end up leading to a lot of different things. When the ligaments that actually surround the spine are stretched, that's when we have an issue of deterioration that's going to lead to arthritis. So basically what happens with arthritis is the joint's going to actually freeze, or it's going to potentially fuse, or it's going to get brittle and it's going to get weak. Well, imagine if the ligaments are loose. If the ligaments are loose, then the spine is going to actually freeze in that position. So you're running into a hunchback situation. We're going to see a big instance of the younger generation now really dealing with hunchback issues when they're in their 50s and 60s, possibly even sooner. Then, of course, we have what are called the facet joints. Those are the little joints that are around the spine. Those are not necessarily what flex the spine, but what allow the joint to move side to side as well. And when we have deterioration of those facet joints, that's going to make us feel stiff. What that ultimately ends up doing is causing the muscles that surround that area to have to work extra hard. When you have muscles that are constantly contracting to try to modify because the spine is weaker or the spine is in a bad position, that's when we run into muscle tension issues. You're running into those knots, and therefore you're not able to do your exercises anymore. It makes it a lot harder to even hold a squat bar on your back because your shoulders are rolling forward and the muscles are too tight. But then there's one other thing that's known as creep. And those of you that are in the medical community have probably heard of creep before. Or if you're into massage, you probably have heard of creep too, simply because massage therapists talk about it a lot. It's when the muscles are compensating because the actual ligaments in the spine are working a little bit differently. They're working against what they're supposed to be doing, so you have this creep of different vertebral tissue, but also muscle tissue that's trying to really compensate everything that's going on. But here's the big one that I talked about in the beginning, a 30% reduction in our lung capacity. What we're not realizing is when we're looking down, we are tucking our chest in, and it's making it so that our lungs cannot get that full breath of air. So if you actually think about taking a deep diaphragmatic breath and you were to fully inhale, you might actually find that it hurts. And it's not because your lungs are hurting. This is a mistake that I personally made. I started feeling this tension in my chest when I would breathe in deep, and I was kind of freaking out thinking that I had some lung issue going on. What ends up happening is you're not able to have that eccentric contraction of the muscles in your rib cage that allow you to open up because they're so constricted all the time. Therefore, you're not able to fully expand and really open your diaphragm the way that you should in order to get that breath. Therefore, we have a 30% reduction in lung capacity, which ultimately ends up leading to a 30% reduction in the oxygen that we're able to get to our muscles when we're exercising in an intense fashion. So what are the fixes? Here's a couple of things that you can do, and these are things that I've made part of my routine, whether I like it or not. They're a little bit uncomfortable, but sometimes you have to do them. The first one is going to be a chin tuck. This is all for building the right strength, building the strength back behind the neck so that you can start pulling the spine back. All you're going to do with a chin tuck is you're going to stand in an upright position, you're going to look straight ahead, and take two fingers and put them on your chin, and I want you to push back directly straight onto your face, so like you're actually pushing your neck straight back. You don't want to tuck, you don't want to look back, you want to look straight on. And the whole idea of looking straight on like that is making it so that you're retracting and pulling your head back. You want to almost try to make it so that you have a double chin. So you're pulling straight back, try to make a double chin, and that's going to be really, really effective at strengthening that area. If you do that for sets of 15 for about 4 or 5 different sets, you're going to be in really good shape. Just do that daily. And then we have shoulder pinches. This is something that people don't think about when it comes down to text neck either. Remember how I said your shoulder blades are getting weaker, the muscles that retract your shoulder blades are getting weaker? All you have to do with these is literally retract your shoulder blades, pinch and hold for 1 to 2 seconds, and relax. Just roll them back, pinch and hold for 1 to 2 seconds, and let them back. You're going to do that for, again, sets of 15, doing 3 to 4 sets. That's all you need to do in a given day. It's pretty straightforward. Okay. Then we need to start encouraging the opposite range. The kind of exercises that you can do here, you're going to do things like foam rolling. You want to roll out your upper back whenever possible. Whenever you have tension, it makes it really hard to retract, especially when your shoulder blades are weak or the muscles that retract your shoulder blades are weak. So then you're locked into this position. But if you loosen them up, you're able to get to a position where you can actually roll back and you're not constantly fighting it. Use a lacrosse ball. Put a lacrosse ball up on the wall and roll it out. It's almost doing a form of self-massage. You're rolling out the shoulder blades as much as you can, rolling out where the trapezius inserts near the rhomboids, underneath the rhomboids. Okay, then you want to loosen your pectorals. People don't think about that when it comes down to text neck either, but it's a contributing factor. If you're looking down and your shoulder blades are weak, everything's rolling forward. You have this anterior roll here, and that's shortening your pec major and especially shortening your pec minor. So what you need to do there is, again, use that lacrosse ball and roll that area out. So I know that this is really random compared to the type of topics that I usually do, but I figured since it has that correlation with lung capacity and your ability to actually get oxygen, that it's something that you would like. And as always, if you have any questions on the topic, make sure you hit me in the comment section below. But if you have ideas for future corrective exercise videos and things that you can use to help get you through the day and get you through some of these weird little things that come into play just with daily life, make sure you let me know. As always, keep it locked in here on my channel, and I'll see you in the next video.